It's not really very good to talk about chair work. You really need to kind of see it, right? It's okay to talk for a little while, but you really want to see what it looks like. And I've been ruminating about how am I going to do this? Would I get a volunteer? How should I organize this with the group? And when I walk in the door this morning, Andrew Tucker comes up to me and says, "Scott, hello, do you need a volunteer?" So there we go. The universe came to my rescue. So I will talk for a few minutes, and then we'll do a demonstration, and then we'll debrief that experience. So Chairwork Psychotherapy, so this work is the work myself and my colleague Amanda Garcia-Torres. We run the Chairwork Psychotherapy Initiative together. So Chairwork Psychotherapy, as we currently have formulated it, has 12 basic components to it. And the first of the 4 orienting principles, right? And the first of these is the idea of multiplicity of self, right? Of seeing people as having different parts, modes, voices, or selves. The late Dr. John Rowan, the famous British humanistic psychologist, said, "The future of psychotherapy is parts work." Right? And we're looking, I come from schema therapy originally. Schema therapy has got a very powerful mode model, very effective for borderline personality disorder, narcissism, very difficult cases. Many of you probably are doing IFS or know about IFS, certainly another one. We're seeing more and more parts work is the future, right? A couple of people this morning have sort of made reference to parts, maybe not as explicitly as I do. But one thing that's important about parts, especially working with the people we're working with, is if you don't use a parts model, maybe I'll just let them sit. If you don't have a parts model for your patients, it's pretty much inevitable that you're going to run into a moral countertransference, right? Why aren't they doing, why aren't they changing? Why aren't they cooperating? What is the problem, et cetera, et cetera. But with a parts model, you may go, I don't love this particular mode very much, but I know there's a wounded child behind it, right? Or I know there are other possibilities. So parts model really is just an incredibly useful way of looking at patients. So not only is it useful to understand them this way, excuse me, but it's also very healing and transformative to get patients to give voice to these different parts. And the third one is, it's also healing and transformative for people to enact or reenact scenes from the past, the present, or the future. And this connects us to the psychodrama origins of chairwork. You'll see in a minute, chairwork comes from psychodrama originally. And the fourth idea is that the ultimate goal of chairwork, and I would really argue the ultimate goal of all of psychotherapy, is the strengthening of what Freud called the ego, what we call the healthy adult mode in schema therapy, or what I call the inner leader in chairwork, right? This is the true north of psychotherapy. Whenever we're lost, whenever we're confused, we don't know what to do, where is the inner leader? Where is the healthy adult? Find that, go there. Because all good things come from the inner leader, or from the healthy adult, right? Emotional regulation and better functioning in the world. So that's what all therapy is about. Little history. Many of you, Dr. Jacob Moreno is the creator of psychodrama. Actually, Dr. Moreno also created the chairwork technique. But chairwork, as we come to know it, is really the work of Frederick or Fritz Perls, right? Fritz Perls was a regular attendee at these open psychodrama sessions in New York City from the early 1950s until the early 1960s. So it's here that Perls learns chairwork from Moreno, but he actually, I think, moves beyond what Moreno had envisioned and turns into what I would call a psychotherapeutic art form. He also moves it from the group setting to the individual setting. I'll ask the funny question. Anybody interested in psychedelics in here? One or two. So you might notice this little small here. This picture was taken by Stanislav Grof. You know who he is? Breathwork, LSD researcher. So Grof is a young man who's training with Perls at Esalen Institute. So it's interesting, all these lineages we see running through everything. So the 4 dialogues. In 2001, during my training as a schema therapist, I discovered chairwork. I fell in love with it, and I've been completely kind of obsessed with it ever since. In 2008, I began training people around the world. And in 2018, I discovered what's called the 4 dialogues. So I was actually meditating, And this image came to me during a meditation. And I realized that all of chair work could be understood as being based on 4 core stances, right? And this was like a revelation for me. It changed my practice. It changed the way I train people. And so to learn chair work, you don't need to learn 10,000 things. You only need to learn 4 things, right? So that was a huge, breakthrough for me. And it's also really a crystallization of 50 or 60 years of chair work practice, from all over the world. So what are these 4 dialogues? So the first one's giving voice. So we might say to a patient, I'd like to invite you to move to this chair, and I'd like you to speak from your heart or speak from your pain. So if a patient says, there's a deep grief within me, so we might say, can you go to this chair? Can you speak from your grief? Go into it in some ways. Just experience it more deeply, right? Or a patient says, I want to cut myself as soon as I leave the session. Maybe you can move over here. Can you be the part that wants to do the cutting? Can I talk to that part? Can I interview it? Can I better understand it? Also connects us to what I call existential intentionality. Mary Donqua, in her memoir on depression, wrote, that was the day, the first time ever in my life, that I made a commitment to being alive. Not the first time I said I wanted to live or dreamed about living. It was the first time I made a commitment, that I gave myself my word. So Mary Donqua had been hospitalized for depression, had this brutal depression for years. On this day, she says, I take suicide off the table. Right? And I often talk to patients about being at a crossroads. Right? We're going to make a decision. We're going to choose a path. And in chair work, we often invite them to stand behind the chair. And basically, I say yes, I say no, I will do this, I'm giving that up, whatever the decision is. Right? In some ways, at its best, they're choosing life in some way. Right? And the life and death battle, or the battle between courage and fear, another, at the heart of psychotherapy. They choose courage, they choose life. So if giving voice, which interesting enough is a 1-chair dialogue, you just have the patients sit or stand behind a chair and speak, allows us to amplify and give expression to a feeling. We can interview a part to better understand it, and we can empower people to claim authority over their lives and the decisions they're making. If that's a 1-chair dialogue structure, the internal dialogues involves 2 or more chairs. So you might say to a patient, you seem to be of 2 minds about the project. I wonder if you're willing to go to this chair and speak from the part that wants to go forward, and then to this chair and speak from the part that's having second thoughts. Right? So a patient might say, I'm conflicted about the situation, right? And often a conflict, not always, but often a conflict is a conflict between values. And I sort of locate this as kind of an existential dilemma, kind of in the inner leader or in the ego itself. Or they might say, I have a deep fear of elevators. I'm afraid I'm going to die in one, right? So you might do cognitive distortion in 1 chair, rational response in the other. So kind of cognitive restructuring idea, right? Or the patient, I have this voice in my head that keeps telling me how bad I am. Inner critic in 1 chair. Healthy adult, inner leader in the other chair, we call a mode dialogue, a rebalancing of the forces within the self. Right? And storytelling. Robertson Holmes wrote, at the heart of any therapeutic encounter, there is always a story. You might say to a patient, I sense that holding this secret inside for so long has been a terrible burden. If you're willing, I'd like you to move to this chair and tell me the story of what happened. And I would suggest to you that even if you never do chair work, that when patients tell their trauma stories, you invite them to move to another seat, not sit down where they usually sit for their home base seat. That would be my recommendation there. The patient goes, there's stories within me that have never been shared. Would you go to this chair and tell the story, or tell what you want to tell the story? This is the burden of secrets. This is the sacred space of psychotherapy, right? Where stories can come out and be told and shared. Or I told a few people about the accident when it occurred. I do not feel I ever really talked it through, right? The reality is many people don't want to hear trauma stories. I remember a couple of years ago there was this PSA on TV about listening to your friends with mental illness. And you don't remember this? Just listen to them. People, These are hard stories. People get frightened by these stories, right? They don't know what to do. They don't know how to be with them. They're disturbing. They may trigger them, right? So people often learn not to tell the stories. So these stories go underground. So again, another place to tell the stories. And the fourth one are relationships and encounters. I sense that you're still very stuck, even though the relationship ended 2 years ago. I'd like to work with this, if I may. I'd like you to imagine her sitting here in this chair. I'd like you to talk to her and tell her what you're feeling. Right? Patient goes, I know it's been 3 years. I'm still grieving the death of my mother. Right? It's grief and loss. If you go into the grief therapy literature, you find that chairwork is a central technique used or method used in grief work. And Nye Meyer has got a great chapter on that in his book on grief. My father was very cruel to all of us when I was growing up. I'm still very angry about that. Right? So here we can talk to someone who mistreated us, who hurt us in some way, express our anger and our fear and our regret and our grief about that. Or my sister's just impossible. I feel responsible for her, but she's driving me crazy. Difficult relationships, ongoing relationships that are not going to go away but are problematic. And the two core components for relationships and encounters. And the first one is the expressing emotions, what I call the cycle of emotions. Inviting patients to speak from their love, their anger, their fear, or their sorrow, or their grief, as appropriate. The other one is role reversal. Dr. Marino said, role reversal was the single greatest discovery that he ever made. And role reversal is when I go from sitting in my chair, I go to the other chair and I become the other person. Right? We have a module we do on self-compassion sometimes, but this is a way of working for empathy. Here we're going to try and feel what the other person is feeling. Dr. Marino said, so I can see with the eyes of the other, in a poetic way. It's interesting, during the Vietnam War, Dr. Moreno wanted to have an encounter between Ho Chi Minh and President Lyndon Johnson to do a psychodrama together. And they could do a role reversal and play each other and understand how the other saw the war. And Bill Moyers, who I like a lot, but Bill Moyers said, that's a ridiculous idea and totally killed it. But it would have been a great thing for them to do, right? To really feel for the understanding of, one man fighting for the liberation of his country, and the other man terrified of communist takeover of the world, and understand how they each see the same situation differently. Tian Dayton wrote, role reversal allows us to temporarily leave the self and experience the position of the other. So one example. This is an example from Spain. So a man's son dies, and the man is totally distraught, and he basically becomes kind of psychotically depressed. Numerous suicide attempts, and kind of a fantasy of like, I will die and join my son in the afterlife. That's a belief he has. So he's actually in an inpatient hospital, and they invite him to sit in one chair and imagine his son in the chair opposite, and speak to his son. Son, I love you so much. I don't want to live without you. I want to die. I want to join you in the next world. Right? He expresses his grief and his pain. Then they do a role reversal. Can you come over here and be your son? And what's interesting here is you think people would control what comes out of their mouth, but in fact, all kinds of things emerge you wouldn't expect. When he becomes the son says, Dad, I want you to stay alive. I want you to take care of my brothers. I want you to take care of the family. Do not kill yourself. And they go back and forth a few times, back to the father, back to the son. And out of this encounter, the father gives up the thought of suicide and chooses life again and begins his recovery journey. So very beautiful. I just mentioned that it's from Spain because chairwork is done all over the planet. There's a nice article about using chairwork with Asian patients in Asian culture. So you can use this with any population, any diagnosis, any group. A thought I've been having recently, which I think is interesting, and kind of builds from what I've been saying, is that at any given moment in the therapy hour, the patient who is in pain is almost always wrestling with parts that are out of balance, feeling the burden of a difficult or traumatic story or memory, or having a conflict with someone from their past, their present, or their future. So essentially, when we're looking at adult psychotherapy at least, there are really only 3 problems. All of psychotherapy can be understood as various combinations of 3 problems. I realize this may be a bit of a gestalt moment. People say, what is he talking about, 3 problems? But this has come to me out of this work, that things keep leading to this very beautiful model here. No method, no matter how powerful, will work without a therapeutic alliance. Right? So what's a therapeutic alliance as I see it? Well, first of all, empathic listening. It's the idea of presence or emotional resonance with the patient. The second one is authenticity. In 1988, when I was a graduate student, I got a job at the Lower East Side Service Center. Anybody know what that is? Methadone clinic in Chinatown. So I was there at the time when not only was there opioid addiction, but also crack cocaine and HIV/AIDS was hitting at the same time. And it was a very, difficult place for the patients, difficult place to be. So it was a very kind of street, drug-using kind of population scene. So one thing I learned from these patients was that they were since everybody kind of lied to each other in the culture, they were very sensitive to lying and to honesty. And they really valued honesty. So one thing they taught me was, do not say anything you don't believe. So this has been there with my teachers. I don't say things to patients I don't believe. It doesn't mean I say everything I'm thinking. I definitely don't do that. But I don't say things I don't believe, right? Therapeutic optimism, right? We hold the possibilities for the patient. We hold the possibilities of the future. Goethe said, if I treat you as you are, you will become worse. But if I treat you as you could be, you will become better, right? So we hold that. They've lost that at the moment, right? But we hold a vision for the patients. A courageous willingness to go into the pain and the darkness. And maybe it's just true for me, but I find being a therapist can be a wonderful and amazing experience. It can also be very difficult and very frightening. And what Fritz Perls gave me with Chairwork and his own modeling of his behavior is an ability to do very difficult pieces of work. So I'm very, very dedicated to Perls. I know Perls is a very complicated man, not an easy man. But this is an extraordinary gift, at least for me. Perseverance. This is the hallmark of schema therapy. We never give up on patients. I remember being in a meeting with Jeff Young, who said, if you have a borderline patient, you have a patient for life, right? That's the level of perseverance. And perhaps most important is love. Hello, Adelia. So what is love, right? I don't believe if you don't love your patients, they're not going to get better. I just believe it's fundamentally, this is about love, and there's that letter from Freud to Jung, psychoanalysis is fundamentally a cure through love. But Erich Fromm said, love is the active concern for the life and growth of that which we love. Such a beautiful framework for us to work with, for us to listen by. Just a couple more things, and we'll do a demonstration. One thing Amanda and I especially emphasize are called deepening techniques. And this takes us back to the 60s and 70s. It's been kind of a lost art a little bit. But here, a central goal is for the patient to be able to express each voice as distinctly, forcefully, and simply as possible. So we work with patients to curate what they're saying. We curate their language. We're trying to get to higher levels of emotional intensity. If you ever read Gestalt therapy verbatim, Perls is constantly interrupting people to change their language, right? And probably the core part of this is existential language. We want patients to say things like, I want, I am deciding to, I will, I'm choosing to, I will or I will not do something, right? This is the language of the inner leader. We do not want them to say things like, I must, I should, I need to, or I can't. Right? This disavows responsibility and disavows power. And with that, I'm going to invite Andrew to come up here and we will do a little work together.
Don't clap yet, you haven't seen me. This is another, seemed like a good idea at the time. And I love Scott Kellogg.
Thank you again. Why don't you sit over there? So he may change his mind, but what said he wanted to work on his feelings towards a patient in a difficult situation. So just want to clarify. So while we're not doing, if you turn off the camera, that would be good for this part. Stop recording. Thank you. We want to release the emotions. And lastly, it can trigger creative processes within the individual that can lead to new life solutions. We didn't see that so much today, but all these parts engaging with each other. Perls would talk about thesis, antithesis, synthesis. He believed there was a creativity in the space between the chairs. I would like to end by thanking the masters, Dr. Moreno, Dr. Pearls, and Zerka Moreno, Dr. Moreno's wife, who was a major psychodramatist, for the gift of chairwork. And just a final quote: psychotherapy is a sacred encounter between two people that is based in love and the skillful use of the therapeutic arts. And the goals of the work are personal healing and personal liberation. And with that, I thank you for your attention.
Thank you, Scott, very much. And thank you, Andrew, for volunteering and for your vulnerability. I personally found that quite moving. Please welcome Sarah Church. An Introduction to Mentalization-Based Therapy for Addiction Treatment. It should be next. I think it's one big, is it one big presentation? No.
Is that it? I can't say.
Oh. Is it one big presentation? Oh, okay.
This is it, sorry.
Good. Okay.
Okay, so you are, you're using PDF, not PowerPoint, right? You're using a PDF. Just, you can't use a presenter view, so I think, do you want these, do you want your thumbnails on here or not? No. Does it, oh, there, okay. Hi, everyone. So it's tough to come after Scott, but I'll do my best. I just, I have to say, I just love therapy. Like, that was just so beautiful, Scott. Like, it just makes me love therapy. What? Oh, I didn't mean to step on your thing. All right. So I'm here to talk about mentalization therapy. To tell you a little bit about that, I am Sarah Church. I am someone who's been working in a mentalization framework for about 3 years now, and it's something I'm really obsessed with, so I'm really excited to share it with all of you. Some of you may know about it, some of you may not. This may be the first you've ever heard this word, but I will try to just explain a little bit about it and also how it can be used to treat substance use disorders. Oh, that's not it. How do I go to the next page? Yeah, I'm shorter. Oh, I don't know how to change the thing. Oh. Okay. Oh, okay, I can do that. Fine, thank you. All right. So this is what we're going to go through, all the different areas. We're going to talk about what is mentalization-based therapy, who developed it, what is MBT for groups, how do we do it in groups. I'm going to talk about like the simplest definitions and some alternative definitions. We're just going to talk a lot about it. What are the goals? Why do we use group therapy to practice this therapy? A little bit about what does good mentalization look like, both of the self and of the other. What does inhibition of mentalization look like, and why is that a problem? And how can it be used to treat substance use disorders? And how can you use it to prevent relapse? Okay, so